health challenge of the LGBT community. It pertained to a group of people with a different sexual preference from that of the heterosexual. Most historians agree that there is evidence of homosexuality activity and same-sex love, whether such relationships were accepted or persecuted in every documented culture. There was little formal study of homosexuality before the 19th century. However, early effort to understand the range of human sexual behavior came from European doctors and scientists, including Sigmund Freud and Magnus Hirschfeld. Freud himself did not consider homosexuality an illness or a crime. Hirschfeld found Berlin Institute for Sexual Science Europe's best library archive of material on gay cultural history. With the rise of Hitler, however, the former tolerance demonstrated by Germany's scientific humanitarian community vanished Hirschfeld's great library and was destroyed and the book burned on May 10, 1993. In the United States, few attempts were made to create advocate groups supporting gay and lesbian relationships until the World War II. All through pre-war gay life flourished in urban centers such as Greenwich Village and Harlem during the Harlem Renaissance in the 1920s. The disruption of World War II allowed formerly isolated gay men and women to meet as soldiers, war workers, and other volunteers, uproot from small towns and post-worldwide. Greater awareness coupled with Senator Joseph McCarthy's investigation of homosexual holding government jobs during the early 1950s led to the first American-based political demand for fair treatment in mental health, public policy, and employment. The primary organization acknowledging gay men as an oppressed cultural minority was the Machin Society, founded in 1950 by Harry A. and Chuck Rowland. Other important homophile organizations on the West Coast included One Inc., founded in 1952, and the first lesbian support network, Dollars of Abilities, founded in 1955 by Phyllis Lyon and Del Martin. Through meetings and publication, this group offered information and outreach to thousands. In 1965, as the civil rights movement won new legislation outlawing racial discrimination, the first gay demonstration took place in Philadelphia and Washington, D.C., led by longtime activists Frank Kameny and Barbara Getting. The turning point for gay liberation came on June 28, 1969, when patrons of the popular Stonewall Inn in New York Greenwich Village fought back against ongoing police raid of their neighborhood bar. Stonewall is still considered a watershed moment of gay pride and has been commemorated since the 1970s with Pride March held every June across the United States and Canada.
Hello my classmates, my name is Zohra Ghassavi. I'm going to talk about mental health challenges of the LGBTQ community. First of all, we have to define mental health. The World Health Organization defines mental health as a state of well-being in which the individual realizes his or her own abilities, can cope with the normal stresses of life, can work productively, and is able to make a contribution to his or her community. In 1986, the American Psychiatric Association delisted homosexuality as a mental disorder, and mental health associations repudiated attempts to change sexual orientation as psychologically damaging. The World Health Organization removed homosexuality from its list of mental disorders in 1990. LGBT mental health is likewise shaped by a sense of self-worth, the level of stress to which people are subjected, and the inclusiveness of their workplace and community culture. LGBTQ people have many of the same health concerns as anyone else, but cultural differences and the impact of homophobia, biphobia, and transphobia and systemic discrimination mean that these health needs may be experienced quite differently. Due in part to negative past experiences, many LGBTQ people may delay or avoid seeking health care or choose to withhold personal information from healthcare providers. Studies have found high rates of depression, anxiety, obsessive-compulsive, and phobia disorders, suicidal thoughts and acts, self-harm, and alcohol and drug dependence among LGBTQ people. LGBTQ youth have an increased risk of suicide, substance abuse, isolation, and experiencing sexual abuse. A Canadian study estimated that the risk of suicide among LGBT youth is 14 times higher than to their heterosexual peers. Several large population-based public health studies are discussed in the November American Psychologist by Susan Cochrane, PhD and epidemiologist in the University of California, Los Angeles School of Public Health, who authored or co-authored many of the studies. Specifically, the studies find higher rates of major depression, generalized anxiety disorder, and substance use or dependence in lesbian and gay youth. Higher rates of recurrent major depression among gay men, higher rates of anxiety, mood, and substance use disorders, and suicidal thoughts among people ages 15 to 55 with same-sex partners. Higher use of mental health services in men and women reporting same-sex partners. Gleaning this type of information on LGBT people has never been possible in general surveys before, Cochrane notes. However, because the surveys on which these studies are based examine HIV risk factors, including psychiatric problems and sexual behavior, they include questions on sexual orientation and sexual partners, she says. It's a breakthrough because it has traditionally been difficult to gather large samples of gays, lesbians, and bisexuals due to their small numbers in the population, Cochrane explained. Cochrane believes the studies demonstrate the need for better psychological treatment for LGBT people, an observation consistent with the U.S. Surgeon General's recommendations in his report on sexuality and health, she observes. Thank you for watching.
Hi, my name is Christina Forbes, and my report is about what factors impact mental health among LGBT community. Socioeconomic factors or determinants play a key role in mental health and well-being for all of us, and are particularly important for marginalized population. The three significant determinants of positive mental health and well-being are social inclusion, freedom from discrimination and violence, and access to economic resources. All these three factors impact LGBT individuals and communities in Ontario. Also, bisexual and trans people are overrepresented among low-income Canadians. An Ontario-based study found that half of trans people were living in less than $15,000 a year. LGBT people experience stigma and discrimination across their lifespans and are targets of sexual and physical assault, harassment, and hate crimes. Hate crimes motivated by sexual orientation more than doubled in Canada from 2007 to 2008 and were the most violent of all hate crimes. An Ontario-based study of trans people found that 20% had experienced physical or sexual assault due to their identity, and that 34% were subject to verbal threats or harassment. Trans people in both Canada and the US reports high level of violence, harassment, and discrimination when seeking stable housing, employment, health, or social services. Additional factor that may impact on mental health and well-being for LGBT people includes the process of coming out, sharing one's identity with others, gender transition, internalized oppression, isolation, and alienation, loss of family or social support, and the impact of HIV and AIDS. The facts and figures that these people are facing are higher rates of depression, anxiety, obsessive-compulsive and phobic disorders, suicidality, self-harm, and substance use among LGBT people. Double the risk for post-traumatic stress disorder than heterosexual people. Youth and trans people face increased risk. For example, LGBT youth face approximately 14 times the risk of suicide and substance abuse than heterosexual peers. 70% of trans respondents in an Ontario-based survey had seriously considered suicide, and 45% had attempted suicide. Trans youth and those who had experienced physical or sexual assault were found to be at greater risk. There is also evidence that LGBT people are at higher risk for substance use issue than general population. Some research suggests that use of alcohol, tobacco, and other substances may be 2 to 4 times higher among LGBT people than heterosexual. A Toronto-based study found significantly higher of smoking among LGBT adults, 36%, than other adults, which is 17%. This is the end of my report. Thank you.
Hi, my name is Jezreel, and I will be discussing the recommendations. Promoting positive mental health and well-being. Key factors for positive mental health and well-being for LGBTQ individuals include support from family and friends, particularly for the youth, supportive workplaces and the neighborhood, low levels of internalized homophobia, which can be fostered and supported through identification or community building with LGBTQ individuals, addressing the social determinants of health. These recommendations come from Rainbow Health Ontario. And for the information for healthcare providers for the LGBT community, the Rainbow Health Ontario, a provincial organization which seeks to promote the health of Ontario LGBTQ individuals, recommends the following steps to be taken. Increase awareness of the broader social and legal context with LGBTQ clients. Become familiar with the degree of which internalized discrimination can impact health. Develop understanding of the social determinants of both physical and mental health, promote family acceptance of LGBTQ adolescents, and encourage them to connect with LGBTQ communities. Provide appropriate equity training to ensure that suicide response and crisis intervention staff approach LGBTQ clients without stereotype or discrimination, and that the gender of trans clients is not misidentified. Improve recognition that individuals who belong to multiple marginalized communities may face additional barriers. And for our conclusion, LGBTQ may have existed since ancient history, although we cannot find any documentation about it during those times. LGBTQ have been ridiculed, discriminated, and on extreme cases, persecuted. Everyone have experienced discrimination at some point in their life. Although one can say that they are different discriminations, they are all discriminations all the same. Discrimination is disrespectful if it is imposing your culture and belief to others, and it is stereotyping. According to Rosemary Parr's human becoming theory, man is a combination of biological, psychological, sociological, and spiritual factors. The theory posits quality of life comes from each person's own perspective. This applies to everyone, no matter what culture, belief, religion, or preference you have. Only you yourself can best define what is best for you. Others can give you suggestions, comments, but in the end, the decision is for you to make. Again, this is Group 5, and we thank you all for watching our presentation.